particularly for mental health, I would definitely say please, definitely utilize your free counseling services, as well as share that information with your friends that are students here as well. You do not have to have UC SHCS in order to utilize these services.
Yeah, like I said in the previous podcast, just really utilize your resources. Like, we're here for you, mental health-wise or safe party-wise, and we just want you to be safe, and there's a lot of resources for you in order to do that. So just please check us out if you're interested.
Welcome back to Aggies Talk Health, brought to you by Student Health and Counseling Services and the Student Health Advisory Board. I'm your host for today, Aruna, and today we're back with HEP, Health Education Promotion, to talk again about a little bit more of the topics that HEP covers. And today we have with us Stasha, part of Teaching Kitchen, and Steph, part of Aggie Mental Health. And thank you guys again for coming back and joining us for our podcast.
Yeah, thank you for having us.
Yes, of course.
And this time I wanted to start a little bit about Aggie Mental Health, which Steph, you're a part of.
Yes.
And so I just wanted to ask, first of all, what does Aggie Mental Health oversee for students, and what can students expect from your organization?
Yeah, definitely. So Aggie Mental Health covers different areas. So for example, specifically what I tend to work on is the Aggie Mental Health Instagram account. So we know that students are on social media a lot of the time in between classes or right before bed, so we really try to disseminate a lot of information through Instagram. So we know that presentations and word of mouth is helpful, but social media really keeps students connected to the resources a lot of the time, so that's primarily what I'm working on, as well as little projects such as Mental Health Awareness Month, which is May. And for Mental Health Awareness Month, we try to compile different events taking place across campus, as well as different events that we're hosting, so that takes a lot of planning, definitely on the back end, and we're planning behind the scenes, and so I try to collaborate with other spaces around campus. And then in addition to Instagram as well as Mental Health Awareness Month coordination, we also host events such as Therapy Fluffies or compiling resources for the Red Folder. But yeah, it's really covering ground in different areas, presentations, you name it.
I've heard of the Red Folder associated with Aggie Mental Health, but I'm not really sure what that is or what that really means. I was wondering if you could talk about that a little bit more.
Yeah, definitely. So the Red Folder, just hearing it doesn't necessarily tell you what that is, and it can sound a little alarming, like a Red Folder, oh my gosh. But the Red Folder is actually a resource to help you help others. So if you ever find yourself in a state where, hey, I know UC Davis has mental health resources, but I'm not exactly sure what they are, and I am in a crisis, or my friend is in a crisis, who do I reach out to? I don't want to call 911, or I don't know if Health 34 can help me in this specific situation. You're just not sure how to go about the situation. Definitely visit the Red Folder. Just search up UC Davis Red Folder, and it should pop up on your search. And it'll essentially give you different resources and tell you when you should contact that specific resource. So for example, a few of the resources outlined on there are OSSJA, which is the Office of Student Support and Judicial Affairs, and it outlines how they can help you if you're experiencing any distress or you're not too sure how to go about a specific situation that you're in. It also highlights Health 34, which is a fairly new service, but it's really getting out there, and we love promoting it because they're really helpful in helping with any roommate conflict, test anxiety, whatever it may be. But we also outline on there that if you are in a crisis and you are in a state of an emergency, to definitely dial 911, because they should be dialed if someone is in a state of an emergency. But yeah, the Red Folder essentially highlights different resources, more than the ones I just mentioned now, and I definitely recommend checking it out to see what different services are offered.
And I just wanted to ask about the resources at Aggie Mental Health. Is it all free for students, or do you have to have UC SHCS to book an appointment with the counselor?
Yeah, so counseling services is completely free of charge for all students. You do not have to have UC SHCS in order to utilize this service. If a student does need longer-term therapy, then they can be referred to a counselor that's outside of UC Davis, but all students who may want to see a counselor is accessible completely free of charge, and you would book that appointment through the Healthy Messaging portal. Or if you need further assistance with booking that appointment, you can also call Student Health and Counseling Services, and they'll go ahead and help you book that appointment.
Okay, that's perfect. I'm glad it's free for all students, because I think everyone needs to talk to a counselor sometimes.
Yes, definitely. I think it's definitely an underutilized resource. A lot of students go through graduating without ever seeing a counselor here, and I'm like, hey, if you ever find yourself in a moment where you're like maybe experiencing test anxiety, roommate conflict, whatever it may be, and you're like, I could really use talking to someone or booking an appointment, I'm like, why not utilize the resource? It's free, it's there, so definitely utilize the resource. Yeah,
that's a really great resource. And I wanted to get into a little bit more about Safe Party that HEP also oversees. And so I was wondering what different resources Safe Party covers and what they basically are like here for students.
So Safe Party is all about like drug and alcohol education and like awareness. Try to provide resources for students so they can party safely, pretty much, as the name implies. So like they on their Instagram, they promote a lot of like safe party tips and resources and what to do if somebody's in an overdose or, you know, inebriated. So they have a lot of those resources, and they also provide free Narcan and fentanyl testing strips. And yeah, just trying to make students safe, and students can still make those choices, but making those choices safely.
Got it. And I want to ask, like, what should someone do if they do see a student overdosing?
So that's definitely a very scary moment to be in. And before you find yourself in a situation like that, if you feel you will be in a situation like that or you're attending a party coming up, I definitely recommend stopping by Cal to pick up a free fentanyl testing strip as well as Narcan. And in a state of an emergency like that, you would have to dial 911.
Okay. Is it 2 different testing strips or like one for both?
Yeah, so the fentanyl testing strip tests for overdose, and then the Narcan would be administering the Narcan to allow help to arrive.
I think to clarify, I think the fentanyl testing strips test whatever substance it is to see if it has fentanyl in it, to make sure it's not laced.
Fentanyl. Yes.
And then the Narcan is if they do have a fentanyl overdose, the Narcan will counteract the fentanyl and make sure that person is safe.
Okay.
And then meanwhile, like, help arrives. Yeah.
And does it say, like, on the box, like, how to use it and everything?
Yeah, so we have a little, like, instructions when we give out the fentanyl testing strips as well as the Narcan to administer. And if you need additional information, feel free to chat with us here in Cal, and we can definitely help you.
Okay, perfect. And I was also wondering, where can students go to manage substance abuse? Is there, like, counseling or a specific area they can seek help in?
So there's the Collegiate Recovery Program, which is actually a really new program that HEP is just kind of taking over. And so, like, all the details about those resources aren't quite known to us yet, but that's where students can go if they're actively struggling with substance abuse.
Yeah, and they can connect you to on or off campus resources. So if you're not too sure how to navigate that, definitely reach out to Collegiate Recovery Program, and they can refer you over to whether you want to seek services on campus or off campus.
Yeah.
Okay. And to reach out to them, can they just, like, search it up online for Collegiate Recovery Program?
Yeah.
Yeah, I think so. But yeah, to clarify, I feel like Safe Party is more of the prevention side, and then Collegiate Recovery Program is more like the intervention side. Like if you're already in that kind of situation, what do you do?
Okay.
Yes.
Got it. And once again, I wanted to ask both of you the question of, do you have anything else you wanted to specifically say to students at UC Davis about either mental health or drug overdosing and Safe Party?
So particularly for mental health, I would definitely say please definitely utilize your free counseling services, as well as share that information with your friends that are students here as well. You do not have to have UC SHCS in order to utilize these services.
Yeah, like I said in the previous podcast, just really utilize your resources. Like, we're here for you, mental health-wise or Safe Party-wise, and we just want you to be safe, and there's a lot of resources for you in order to do that. So just please check us out if you're interested.
Yeah, thank you so much for coming on our podcast again and talking about all things HEP today.
Thank you.
Yes, thank you.
And thank you for watching Aggies Talk Health. And I'm Aruna, and today we shot at the Cal building, and hope to see you guys next on our next podcast.